Now we are done with the autopsy. We have performed the post-mortem examination, and we are moving on towards the ancillary investigations and the report formation. The autopsy report, basically why are we performing the autopsy? We have to document the autopsy in detail. Now, this documentation is very important. Even the notes that the rough notes that you carry out while performing the autopsy, even they are presented as at some level in the courts if it is done by the doctor and if they are preserved. So the autopsy is basically something that is documented, and it has a high significance. Even after several years of performing the autopsy, you're called upon any case if it is reopened, and you're asked to get your reviews on the report that you have written. So you have to be very careful while writing this autopsy report, and we have to be very specific. You don't have to give any comments regarding the cause of death. Basically, the cause of death is basically dealt in with detail in the last section. But how were basically the incidents performed? This is not a part of the doctor to basically deal with that section. It's the part of the police and the investigating authorities that are performing the investigation. They are basically going to review the serial of incidents that must have taken place towards the cause of death. So you have to keep all these things in mind. In this section, we'll be dealing with microbiology, the histology, and the toxicology. So after getting our hands on the sampling of the dead, basically we send these samples to the microbiologist, to the histopathologist, and to the toxicologist, along with certain notes, along with a brief history of the case, whatever we are performing. So the imaging and the photography. It is also done at the scene, even by the doctor, whosoever is going to perform the autopsy. He's going to perform some sort of imaging, and even he's going to perform some sort of photography at the level, at that crime scene. And finally, the autopsy report, the formation when the autopsy is done. The whole procedure is done. We have got the samples. Then we are going to move on towards the autopsy report formation. So the ancillary investigations. The ancillary investigations, when we talk about, it basically means the histopathology, the microbiology, the toxicology, that are basically the things that we dealing with in the lab. So the lab investigations are known as the ancillary investigations mainly. And moving on, we'll be discussing basically, first of all, the microbiology. Now, the microbiology, the bacteriology of the samples that we have sent to the chemical pathologist. Now, bacteria can enter the dead body from a lot of ways. For example, it can be any previous infection if the person was suffering from before death. So they can be found in the dead body after the samples are taken. Secondly, it can be an agonal transfer. Now, basically, an agonal transfer is from the environment after the death. It can be any basically incision that was given during the post-mortem. Even that can cause the spread of this bacteria towards the dead body. So all of these bacteriologies, they can be sent to the chemical pathologist. Now, for example, I'll give you an example. The vegetations on the heart, the mitral valve and the tricuspid valve, they can be vegetated at any level. And to diagnose these vegetations, we have to send these valves. If we found any scrappings on inspection, we can be slight doubtful about any vegetations, about any signs of endocarditis that can be the cause of death. So they can be sent to the chemical pathologist for further detailing, and to get our basically the evidence that can be towards the cause of death. So these sections are basically a lot of sections, even from the brain, from the lungs. They are the horizontal sections. They are sent to the chemical pathologist, and the slides are made for these organs, and they are basically towards the cause of death. So the toxicology. Now, when we are dealing the toxicology of the samples that we have taken. Now, what are the samples that can be taken for any signs of poisoning? They can be the urine samples, the stomach washing that we have taken while we were dissecting the stomach. It can be the CSF fluid, that is very important, and it can be sent to the chemical pathologist for any signs of poisoning. Then the ocular fluid, that is also sent to the chemical examiner. So all of these, the urine, the CSF, the stomach wash, all of these are sent to the chemical pathologist, and they are dealt in with detail to find any evidence of poisoning. It can be a case of acute poisoning, and it can be in a case of chronic poisoning as well. So we have to diagnose these cases of poisoning. For example, in cases of any, for example, in cases of any occupational hazards that were encountered by the person that we are dealing our autopsy on. For example, the asbestosis and the pneumoconiosis, they are found in the workers of certain industries. So they can be found in the sections of the lungs. So all these samples are sent and further investigated. And finally, moving on to the histology. So the histology, when we are dealing with histology, basically we get our sections of different organs, that is the brain, the lungs, and the kidneys, the adrenals, the heart, and they are sent to the examiner, and the slides are made. The hair samples are even sent sometimes. The semen is sent, and all of these slides are made, and they are basically put on for the histological examination to get any kind of evidence that can contribute towards the cause of death formation. Now, the autopsy, radiology, and the post-mortem imaging. So at this level, basically what is happening over here, the sulca and the gyri are quite visible in the CT and the MRI. We can diagnose the cause of death at this level. Now, this is basically the heart lying over here, and we can find any kind of pathology. If it is found, it has to be sent to the specialists to get the diagnosis for this kind of deaths. So the autopsy, radiology, and the post-mortem imaging. Now, this is an MRI which is showing the cause of the sudden death. So basically, it is a thrombus which is formed at the heart, and it can be basically diagnose the cause of the sudden cardiac death that was encountered by the person. The forensic photography. Now, the forensic photography, when we are dealing with this topic, it's basically quite simple. You have to get your hands on particular gadgets that you have, the type of lens, the type of focusing that you want to have at the crime scene. That is very important. Then certainly you are going to focus on the person, not on the backgrounds. For example, people standing on the background, they can be very distracting. So while you're photographing, try to get a complete focus of the person that you're going to perform your autopsy on. That is very important, and that is very significant. Because the photographs should not be distracting. They should be towards evaluating the cause of death. They should be towards the evaluation of the important things in the surroundings only. That's it. So the type of the focal lens that you're going to use for your cameras, that is very important. Now, what are you going to photograph? You're going to basically photograph the person, the posture in which he was lying at that time. It can basically contribute towards the calculation of the time since death due to the rigor and all. So the type of clothing and the external examination, even you can review it later on when you're done with your autopsy and you're just sitting on your table and starting to write down your autopsy report. It can contribute towards your findings. The autopsy report. Now, moving on to the autopsy report, it's basically a comprehensive review of all the things that you have done, even starting from the photography that was done at the crime scene. So you can write it down. But first of all, the initials. The initials are really important, and you have to get your hands on the initials. You're going to basically moving on, you're going to write down the whole details of the external examination. Then you will be moving on towards the internal examination. This is basically discussed over here. And every detail, every particular detail is basically discussed when you're documenting any autopsy that you have already performed. The types. The freestyle essay. So it's basically the legal acquisitions of any state. It can be a freestyle essay. You can start off with any peculiarities. It's not a clinical history taking. It's not a clinical case investigation, any ward investigation that you're going to present to anybody. It's basically a post-mortem examination. You have to keep in your mind what were the significances towards it. So it can be a freestyle essay. It can be a printed performer. So in many countries, there is a typical pattern that is basically followed. Basically, it is basically dealing with the most basically the things that are happening over there in their area that are peculiar to their area. For example, the firearm injuries that can be common in certain areas. So they are basically pointing towards those, and it's basically a printed performer, and you just have to fill on that performer. So it's a kind of easier way to write the autopsy report. Now this is some sort of a printed performer that is basically found. The personal full details. So they are the highlights. We are going to start off with the personal full details at the initials. The place, the date, and the time of autopsy is very important. The name, the qualifications, and the status of the pathologist, whosoever is performing the autopsy report. The persons present at the examination, of course, they should be dealt with. The authority commissioning the autopsy. So whatever authority that is basically commissioning it, it should be mentioned. The record of who identified the body, that is very important. Name and address of the deceased subject's regular medical attendants. So these are the highlights, the date and the time of death, the list of the specimens and the samples. As I've already mentioned, the toxicology, histology, the microbiology that was sent to the chemical pathologist that I mentioned here in detail. The results of the examination, of course, the summary of the lesions, whatever traumatic cases we are dealing with, we have to summarize them in detail over here. The persons present at examination, that is very important. The formal cause of death. Now, what was basically the cause of death? It's very important. The main cause of death. There can be a lot of injuries to the person, but there can be a certain injury that is, there can only be a single certain injury that is basically causing the death of the person. So you have to document it with a surety, of course, and the signature of the pathologist finally. The history and the circumstances of the death, they are also dealt in with detail. So it is basically a full review of the external and the internal examination, the person who is performing this procedure, the details of the person. This is a full report and is documented, and I've already emphasized on this fact that even after several years, you can be called upon in the court and you can be asked for your opinions on this autopsy report. So always be sure whatever you're writing in the autopsy report. So this was all for this section. We are finished off with our autopsy report writing, our autopsy procedures, and how are we going to perform it. Thank you for watching sqadia.com.